This is Don, the AS lifter. This is my second video. I talked about in the first video about Humira. This is one of my Humira pins. This one's already been used. It's just basically an EpiPen that you inject yourself with. And what this is you may have seen the commercials and it sounds like a nice little pill. But what this is a biological. And what that means is this is a biological made medication. And this medication, when you inject it into your thigh or your stomach, lowers your immune system. The medicine or the biologicals in the shot attack your immune system, suppress your immune system, because in autoimmune diseases and such as like ankylosing spondylitis and many others, our immune system is what's attacking us. In my case, my immune system is trying to basically attack my joints, attack my muscles, attack some of my organs. I have some fusion in my L4 and L5. It's partially fused. I also have some growth, bone growth, irregular bone growth on my SI joint, as well as my sacral cavity, which is where your sciatic nerve runs through. I have bilateral narrowing, which means I have narrowing on both sides. So I constantly have a pain of that sciatic nerve pain that some people complain about or fret upon. With people like people that have AS, it's pretty common that we deal with it all day, every day. Again, this is Humira. There's many other ones. There's Imbrol. I can't remember all the different names, but some people like myself, we are lucky enough to where the biologicals work and that suppress our immune system, but there's also trade-offs. I have no immune system. I get sick easy. I get infections easy, and I also fight some other trade-offs for the medication to work. Some people are able to treat it by diet. In some cases, some people have found that they can use a low starch, low gluten type diet, no dairy, kind of real similar to what they call a paleo diet, I believe, and that they're using that to help fight their inflammation side effects. In our disease, the inflammation is the biggest issue. And when inflammation sets into the joints or inflammation starts and the blood cells and the immune system starts kicking in, it's almost impossible to stop it, except for in time and either treatment or medication or stretching or just let it run its course. Again, in 2014, I was diagnosed with this disease. My worst flare-up was in 2014, and it lasted approximately, I'm saying between 6 and 8 months. If you can imagine 6 and 8 months of just no pain, no sleep, no movement, stiff. I couldn't even straighten my legs out. My neck muscles were drawn up. I had issues where my neck muscles pulled so tight it pulled my collarbone out my sternum, along with some other painful sides or effects that I had. Hands hurt, feet hurt, Achilles tendons just would not stop the pain. So it was pretty horrific. And some people aren't lucky enough to where things like this work. They deal with the pain all day, every day. They may have an allergic reaction to this, or they're so far into the fusion, which is what our disease does. Is as the immune system attacks, our body naturally wants to grow bone to almost shield off the immune system as a defense mechanism. In the case of people with ankylosing spondylitis, it's not uncommon for their hips to fuse, meaning their bones grow together and it becomes immobile. Knees fuse. I mean, there's cases of ankles fusing. Most common is your back. Your backbone, if you imagine all those vertebrae start fusing together and it becomes one solid piece, and then your ribs fuse in, which causes other issues with your breathing because you can't expand, your lungs can't contract, and then it starts just a whole series of health issues. There are cases where the inflammation affects the muscles of the heart, the liver, the kidneys. Real common with the eyes. I've had a lot of eye issues where my retinas have become inflamed, and it affects your vision to where you're almost to the point of being blind. You can't really make out shapes. Light's real sensitive. Even sunglasses don't help. I could be in a dark room with sunglasses and still my eyes would be on fire. That usually lasts, for my personal case, between 3 to 6 weeks at a time. I think the worst case I've had was roughly 8 to 10 weeks, and that was again before I was first diagnosed. So this is Humira. This is a little bit about Humira. Again, I'll touch in on later videos about the depression side, because that's a big issue we face, and kind of some of the things that are some of the outlooks I had on that. Again, follow me on Instagram, which is Texas Markham. Facebook, I'm at Don Markham, a fitness journey with ankylosing spondylitis, and again on YouTube, Don the AS Lifter.